now, and then I'll introduce the session again. So welcome to the session on urban growing and agriculture. The question that we are posing is, how can urban growing help tackle food insecurity and the climate emergency? Jeremy Isles is going to be hosting this session, and I'll be speaking later. So I'll hand over to Jeremy.
Okay, thanks, Anna. Hi, everyone. Hope everyone's okay, no matter where you are in the country, suffering from various restrictions and no doubt feeling a bit lost, perhaps, and a bit autumnal. So if you want to stick anything in the chat, just saying, I feel fab, I'm really optimistic, what's all this about? That'll be just to sort of, lighten the mood slightly, perhaps. Personally, I'm in Bristol. It's raining. I've been out on my bike to get a bit of exercise, a bit of fresh air. And I've had a couple of meetings already today. So so what is this all about? Perhaps I should just say we've also got Elizabeth Westaway in the session, who apparently is an absolute star on Twitter and has had 4,500 people commenting on her recent tweet. So perhaps we can all amplify that later on. Elizabeth's going to talk about the regenerative benefits of social prescribing. And we've worked together over the last couple of years and sort of keep on coinciding with things about people's food policy, things about the Urban Agriculture Consortium, things about social prescribing. So we've wrapped these two things together and hopefully we'll all be able to make connections with that. So I'm just going to give you a sort of rapid introduction who the Urban Agriculture Consortium is and what it's doing and where it came from. So I was working at the Federation of City Farms and Community Gardens from 2000 to 2016, doing all things to do with community gardens, city farms, allotments across the UK. And when I left there, set up a small CIC and looked to see what projects we might be able to get involved in. And to cut a long story short, put in a bid to develop some early stage research into urban agriculture and opportunities and barriers. And that has evolved over the last 3 years with a lot of conversations and a lot of consultations into the consortium, which includes Permaculture Association, Community Supported Agriculture, Open Food Networks, Social Farms and Gardens, and others. And we've now got a grant from Esme Fairburn to do some more work. Hooray. And the idea is quite simple: to support communities to upscale urban and peri-urban, nature-friendly urban farming and growing. And by that, we originally meant enterprise level, so scaling up into box schemes, scaling up into local supply, scaling up to be able to engage with dynamic procurement. And that was all to do with climate change and food poverty and food security, because we started this program back in 2017. Clearly, with COVID, it's meant that there's been a great deal of interest in re-localisation, in where our food comes from, food security, and the ongoing unresolved issues of Brexit are putting all that into sharp focus, as indeed is the daily information about school meals and food poverty. So there's a lot of interest in, can we relocalise our lives in all aspects, whether that be transport or offices or working, but food fits really clearly into that. We started to work with cities in the north, including Lancaster, where Anna is, Leeds, Sheffield, Middlesbrough, Greater Manchester, Nottingham and Leicester, although they're arguably in the Midlands rather than north. And we're doing what we're calling some research with these pathfinder places. And we've done a lot of work on that, and Anna will refer to that a bit later on. So in a sense, what we're doing is simply adding another message to other projects and other initiatives that are already out there. So we're working with Sustainable Food Places, with the Land Workers Alliance, with Sustain, with all these other initiatives to try and amplify and accelerate the message about urban food production at scale. But we also recognise that increasing urban food production in schools, in window boxes, on allotments at community level is also important nowadays. So that's where we've come from. We're sort of looking up a typography of urban food growing, if you like, and I'm just going to try and share this with you briefly. So this is something I did last year. It says, if you see in the top left there, it says Control Shift. So this was for the Control Shift conference back in May last year, which was in Stoke-on-Trent. Just talks about climate change, Brexit, food security and poverty. Clearly, this was before COVID. But in the middle, that sort of squiggle of diagrams is, if you like, the gradation between an inner city food growing initiative and an peri-urban and even rural food growing initiative. And so right in the middle, it says demonstration plots, planters, rooftops, vertical growing, underground. Then it says parks, allotments, city farms. And as you move out through the urban fabric, you get slightly larger small holdings, whether they be community run or small and medium-sized enterprises. Going further out, you've got what we're calling agroecology incubators. Great example of that is in Bristol, called Grow Wilder. Used to be Feed Bristol, where they're growing food in a biodiversity context. And then further out from that, CSAs, community supported agriculture, and box schemes, moving out into small, medium-sized enterprises, and then into what you might just say straight commercial farming. And at the bottom, it just says there, what are we actually going to deliver? We're looking at land access, people, we're looking at finances, dynamic procurement. But a big part of this work is going to be about policy influencing, because without the support of local authorities at a significant policy level, this won't gain traction, because they need to make land available. With security of tenure, they need to have dynamic procurement in place for local people to be able to get their food and produce into the markets. So that's where we're up to. It's difficult working in these Zoom contexts, but we are finding a great deal of traction and resonance with this message. And I think coupling it to the regenerative benefits of social prescribing, health and well-being is going to be a really quite a key message. So at the moment, just to finish off, we're working mainly with this northern cluster of pathfinder places. Next year, we're hoping to expand that into the south of England, and we're just beginning to look at how we're working with the Scottish Community Growing Forum, with the Land Workers Alliance and people in Glasgow, looking at the Food Policy Alliance Cymru in Wales with their workers, and later on, hopefully we'll have a little link in Northern Ireland as well. So I'm not claiming we've got all the answers, but we've made a really good start and it's quite positive. So thanks. Oh, sorry, Elizabeth. I'm sorry, yeah, I'll hand over to Elizabeth. Hello, Elizabeth.
Oops, why is that not working? Oh, that doesn't want to come up as a slideshow. Why is that? Let me do that again.
I'm not sure. Have you saved it to your desktop?
Yeah, I mean, it worked perfect. Oh, hang on, I didn't click there. Share. Oh, that's not wanting to come up again either.
We can see the slides, so you could just go through.
Oh, what a shame. Okay.
We can still see it. That's good.
Right. Okay. So, little hiccup there. Anyway, so yeah, thank you very much, Jeremy. And really appreciate this opportunity of speaking about regenerative food growing and health. I've got rather a lengthy title here, and the potential of social prescribing, food and food growing for physical and mental health and emotional well-being. Oh dear, hang on. Okay, so just wanting to set the scene in terms of what business as usual is. So we've got increased industrialization of our food system has led to both environmental degradation and epidemic levels of lifestyle related diseases. And current statistics show that in the UK, obesity levels are 28.6% for females and 26.9% for males. So at the same time, our healthcare system continues to prioritise pharmaceutical intervention over lifestyle changes like diet and nutrition. Oops. So I thought this quote by Wendell Berry nicely describes our current predicament, where people are fed by the food industry, which pays no attention to health, and are treated by the health industry, which pays no attention to food. So in order to move forwards, we need to have an entire food system transformation to ensure that health, equity and environmental sustainability are firmly on the table. We also need to appreciate that health begins with food, and healthy food begins in the soil. So essentially, healthy soils equals healthy plants, equals healthy food, equals healthy people. Right, so the soil a plant is grown in has an immense effect on what is contained within it, so such as carbon, water and nutrients. And a healthy, high-functioning soil produces crops that are flavourful, aromatic, nutritious, and they actually shouldn't rot, they should desiccate. So the objective of growing crops should be to produce nutrition that will cause people to thrive. And regenerative growing practices such as agroecology, agroforestry, regenerative organic agriculture and permaculture produce high quality food without using synthetic chemicals, whilst also improving soil health. And this can actually increase the nutrient density of food and help with environmental issues such as the climate emergency. So to improve what we're eating, we need to be eating sustainable, healthy diets. And these are dietary patterns that promote all dimensions of individuals' health and well-being, have low environmental pressure and impact, are accessible, affordable, safe and equitable, and are culturally acceptable. They also support the preservation of biodiversity and planetary health. So in this way, sustainable, healthy diets comprised of locally produced seasonal food, ideally organic, can improve human nutrition and health outcomes and also support this urgent paradigm shift to regenerative growing practices to restore soil health, increase nutrient, carbon and water cycling and improve planetary health. So it's therefore essential that healthy and sustainably produced food that nourishes us is our right and is the most accessible, affordable, desirable and easy choice for all. So this quote by Masanobu Fukuoka is particularly poignant and is illustrating the connections between farming, health and well-being. So I'll just read it for you. It's the ultimate goal of farming is not the growing of crops, but the cultivation and perfection of human beings. So we also need to transform the healthcare system. And I want to highlight the work of the Rodale Institute in the USA, which recognises this need. And they've recently brought out this paper, which I really would recommend everybody reading because it is really powerful. And it's The Power of the Plate, the case for regenerative organic agriculture in improving human health. So they're proposing a new vision called regenerative healthcare, which is defined as a system in which farming and healthcare work together to inform a prevention-based approach to human and environmental health. So rather than relying on toxic chemicals to solve agricultural issues and pharmaceutical intervention to manage disease, regenerative healthcare aims to prevent disease through an organic, whole foods, plant-forward diet that begins on farms that work in harmony with nature. Now, the report, when you get to the end, it has 9 recommendations to create meaningful change in the food and healthcare system. And these are involving incentivising medical professionals, educating citizens, encouraging food companies to support regenerative organic farmers. So I just want to focus on the fourth recommendation, which is about implementing more localized integrative health initiatives. And what's been found in the USA is that an increasing number of medical institutions and hospitals are implementing programs that focus on increased patient access to fresh fruits and vegetables as part of improving health measures. So you can see the variety of programs there that have been and are being developed. You know, garden-based programs, CSA programs, community gardens at healthcare locations. And what they've found is that programs that provide patients with better access to fruits and vegetables appear promising, and early studies documenting significant improvements in health outcomes as well as cost savings. So there's real potential there. And this is really exciting as there are similarities with what's going on in the UK in relation to social prescribing. So social prescribing, it's not a new concept. It's been around for years, with many people describing it as the community development approach to health and well-being. It's actually a growing movement that connects people with a wide range of non-clinical programs, services and events in the local community. It's a service that goes beyond the GP's prescription pad, and it's designed to support people with a wide range of social, emotional or practical needs. So it's seeking to address people's needs across a number of areas such as physical activity, diet, nutrition, mental health and social support. And it's often referred to as a more than medicine approach to health and well-being, based on the fact that the majority of long-term conditions can be prevented by lifestyle change alone. So here's some formal definitions for you. I'll just highlight a couple of those. So social prescribing is a process of enabling frontline staff to refer individuals to a link worker to provide them with a face-to-face wellbeing conversation during which they can learn about the possibilities and design their own personalised care. And it's a non-medical process that uses assets to support what matters to a person rather than focusing on what's the matter with them. So very different approach. Now, at the recent Northern Real Farming Conference, I was co-organised a session on social prescribing of community urban food growing projects, and 4 of them was showcased there, which I would like to now also highlight because of the fabulous work they're doing. So the first one is called Northern Roots in Oldham. Dr. Mike Hardman at Salford University presented that, and it's on upscaling urban farming and social prescribing. It will become the UK's largest urban farm, and it uses urban care farming is at the heart of the model. So that's really going to be quite powerful when it comes online later. Next one is the RHS Wellbeing Programme in Salford, and that was presented by Dr. Michelle Howarth, who is evaluating a therapeutic horticulture programme for physical and mental health and wellbeing. She's also recently published an article in the BMJ entitled "What is the Evidence for the Impact of Gardens and Gardening on Health and Wellbeing?" So that would be another excellent resource. Now the image here is of the 3rd project, the Woodlands Community Development Trust in Glasgow, and that was presented by Tim Cowan. The project runs a broad range of activities, from a community garden, community cafe, workspace, a neighbourhood food service and a neighbourhood recovery project. And in the first 6 months of the COVID response, they had to adapt their activities, and they focused on delivering meals, doing workshops, outdoor counselling, gardening support for households so that they could grow their own food. And Tim recently was telling me that he feels that the project really benefits, benefits people in terms of being able to be outdoors during COVID. And he was really impressed with the speed at which the community responded to the health needs with little or no input from the NHS. So in effect, they were doing the social prescribing themselves. So again, really powerful stuff. And the Horton Community Farm Co-op Limited in Bradford was presented by Charlie Gray. This is a land permaculture centre for food growing and community resilience in the centre of Bradford. It's working in an area of high deprivation with people from diverse backgrounds, including asylum seekers and refugees and people of all ages. Currently, it's 2 acres of land that was near derelict. Well, it was a near derelict allotment. And projects now aiming to develop their therapeutic work through relationships with commissioners and to take on the whole 5-acre site. And currently they're in a community asset transfer process. Now, the next project I want to mention, I feel is very interesting in terms of looking at like physical health, and it's in the southwest of England. The Grow Share Cook project was commissioned by Plymouth City Council and Plymouth Community Homes, and it's being delivered by Tamar Grow Local and Food is Fun, essentially for people experiencing food insecurity or people at risk of type 2 diabetes who are wanting to change to healthier diets. And they're provided with free bags of seasonal fruit and vegetables and cooking sessions through social prescribing from a GP. And the vegetables are sourced wherever possible from local producers, including community growing initiatives. So that's really, real progression on the idea of social prescribing and food growing. And I've been looking at doing something similar in Swansea. Now, I mentioned...
Elizabeth, a couple of minutes, please.
Yeah, that's fine. Just wanting to flag up the importance of growing nutrient-dense food to maximise health benefits for people, and different ways of measuring it using a Brix refractometer and bionutrient meter. And there's a few organisations who are focusing on developing this, just highlighting the work of Patrick Holden with the Sustainable Food Trust, looking at paying farmers for nutrition per acre. We've got Matt Dunwell at Ragman's Lane Farm, running courses on permaculture and sustainable land use to improve soil health. Gillian Butler and Hannah Davis at Newcastle University showed that pasture-fed cows produce better quality meat and milk with healthy fat. Matthew Adams of Growing Real Food for Nutrition, he's going to be starting a trial in 2021 using the refractometer and Brix tests. And Dan Kittredge of the Bionutrient Food Association in America is developing a bionutrient meter, which uses spectroscopy and will be able to empower citizens to know the nutritional value of the food that they're about to buy at point of sale. So final thoughts. We need an entire transformation of the food system to ensure health, equity and environmental sustainability. Good nutrition is essential for good health. For better health outcomes, people need to be eating high quality nutrient dense food grown in healthy soils, which also sequester carbon. And regenerative growing projects in urban and peri-urban areas have scope to increase the supply of healthy and sustainable food, which also needs to be affordable. So final point is social prescription of regenerative food and food growing actually can connect the agriculture and healthcare systems to improve physical and mental health, as well as emotional well-being, without needing any pharmaceutical intervention. So thank you very much.
Hang on. Thanks, Elizabeth. Can you stop sharing your screen, Thank you. Okay, just a couple of thoughts then on that. We're sort of working this thing through as we're all talking. We're trying to think about the best way forward to rebuild. If we had the power to rebuild our food system and our society, I'm sure we'd all do it in a better way than the current system that's sort of going on, being perpetuated in spite of all the obvious evidence that it's not working properly. I think there's a thing there about the nourishing people and nourishing communities, and that's partly why I think urban agriculture is going to be such a powerful thing, because the majority of people live in urban areas, and creating connectivity and well-being is part of that. And I referred earlier to policy guidance and policy level interventions. Just as a couple of examples before we come on to Anna, in Nottingham, Nottingham City Council have developed with the community, with Nottingham Good Food Partnership, a well-being design guide about how new housing developments and how we retrofit old housing developments are built so they can include food growing spaces. Greater Manchester Good Food Partnership is writing a sort of policy document at the moment to go to the Greater Manchester Combined Authority, which includes local food growing in and around the Greater Manchester area at a substantial level. Now, we don't have a percentage of what a substantial level is, but it doesn't mean 5%, it means 15, 20% going forward. And interestingly, Andy Burnham's going to be the keynote speaker at a conference on social prescribing in March. So Elizabeth and I are working out how we might address that as well. And in Leeds, the City Council have moved from not being interested to being very interested in sustainable food growing as part of a climate resilience policy package, and that's being developed alongside local activists as well. But Anna's part of the what we're calling Northern Pathfinder Places grouping, and so she's going to tell us a bit about what's going on there.
Great. So I'm going to share my screen, and as I do it, I just want to reiterate a point that often when we hear about urban agriculture and like mainstream discourse about it, people talk about feeding people and the need to feed people. What this is unique to this Urban Agriculture Consortium is that we are thinking about how we not only feed but nourish, and what unique aspects around urban agriculture can support that. And the fact that we live in cities and you can bring the growing into the cities and use that as a chance to reconnect people with wider ecosystems is really a really unique and exciting aspect of urban agriculture. So I'm going to talk from a Lancaster perspective to this question: how or can nature-friendly urban farming and growing contribute to tackling food security and the climate emergency? You will have seen me during the week as Anna from Ethical Consumer, but in the rest of my life, I coordinate a sustainable food partnership and network in North Lancashire called Food Futures. And like Jeremy said, Lancaster is one of 4 other places that have just become Pathfinder places as part of the Urban Agriculture Consortium's work, which essentially aims to upscale or scale out urban food growing in a way that environmental and social benefits are designed in. And one of the first tasks that the Urban Agriculture Consortium started to do was to run a very a reflective exercise with each of the places that have signed up to be a Pathfinder city. And Lancaster, here in Lancaster, we went through that process as well. And in thinking through the potential for upscaling urban agriculture to address the climate emergency and food insecurity, we were forced to think about the barriers to upscaling, the potential that we have as a place to do this, the resources we have, who we're already working with and who has the potential to enable us to upscale, and who we're not working with and who we're not connected with, who can offer us an opportunity to upscale nature-friendly urban agriculture. And I guess some of the themes that have emerged from the 4 Pathfinder cities is probably no surprise, but planners are going to be a key stakeholder that we're going to have to work with. Barriers include access to land, potentially finance, having backing from local authorities. There's a whole range of things that came out and Maddie, who unfortunately is not here today, has drawn together this hugely complex reflective exercise and put it into this Miro board, which you can see on my screen here. So this is a very zoomed out version of that board, and in doing this she's pulled out themes and looked at different assets or capitals. So she's looked at access to land, intellectual knowledge and resources, policies and local authority figures that are supportive of work, and tried to draw out patterns and themes. And a few strategic projects have emerged that I guess the Urban Agriculture Consortium is going to progress and support and facilitate. And one of those themes or strategic projects is based around unlocking church land and looking at the potential of church land to be shifted to agroecological production. So we've already started those sort of discussions here in North Lancashire. Dynamic procurement is also a very exciting opportunity at the moment. It can potentially enable a lot of small growers to then access large procurement contracts with local hospitals, restaurants, councils, etc. So the dynamic procurement aspect is also an interesting opportunity at the moment. And then the last strategic project is linked around policy development. And if you were to ask any of the Northern Pathfinder cities right now, I think all of them would say the moment to upscale nature-friendly urban food growing is now from a policy perspective, as a number of local authorities have declared climate and ecological emergencies, and as part of that process are prioritising food and farming as part of their climate strategies. So that feeling that now is the time to harness the energy and enthusiasm to upscale urban agriculture is very much reflected here in Lancaster. So last year, our district council, so Lancaster City Council, declared a climate emergency. And as part of their motion, they committed to running a people's jury process that has been very well designed and run this year. And luckily for us, food and farming is one of the strategic priorities that is going to be recommended to the council by the people's jury. And that's going to officially be announced in December. And for us, this is really quite key, because as an area, as a district council, so we have a two-tier authority, food has never really been on the agenda. So this really allows us to have meaningful conversations with our local authority to look at how we unlock some of their land and resources to enable an upscaling of urban agriculture. Also in Lancaster, we have Food Futures, which is our local sustainable food places partnership. And in a lot of the Pathfinder places that have signed up to the Urban Agriculture Consortium, you find similar partnerships. And these partnerships are bringing together people from across the food system, from farmers through to community food activists, community gardeners, academics, local authority representatives. And they offer such a good platform for allowing for a collaborative process in developing local policy that really embeds key principles that will enable us to both meet local food insecurity needs whilst embedding environmental and social values. So these local food partnerships really allow for and are very well established now for this upscaling of urban agriculture. And similarly, in all the Pathfinder places, Lancaster included, we have brilliant local academic institutions that have people working around this subject area. So in Lancaster, we have Jess Davies, who is now heading the Centre for Global Eco-Innovation. And one project that she's coordinating is a Revolution project that's looking at barriers and potential for upscaling urban agriculture on a national level. So they're working with lots of GIS whizzes and academics to look at what they can do to input into policy development to allow for this upscaling of urban agriculture. And then locally, we have several huge substantial redevelopment plans that are coming up that we can feed into consultation processes around and ensure that food growing is designed into their structures and design. For us here locally, we have the Canal Corridor development, a garden village that's been proposed, and Eden North is potentially coming to the Morecambe area in a couple of years' time. So they all offer opportunities for us building a network of urban growing and agriculture locally. And we are rich in change makers. So everyone here is a change maker, I'm sure. And across the north, there's plentiful supply of enthusiastic people that are willing to help bring around this urban growing revolution. And I just wanted to highlight some of the strategic projects that we're doing in Lancaster to help us in upscaling urban growing. So we have a network of community gardens already and allotments around the city. And so we have a good network of amateur growers. Then we've had a few community gardening projects such as Clover Hill emerge that are larger in scale and are edging towards being more commercial. And we have just hired our first grower for our Lancaster Farm Start scheme, which we're going to be launching in the next growing season. And that Farm Start scheme acts as an incubator and allows for amateur growers to start seriously considering, in a very supportive environment, moving towards commercial growing. So those are just some of what we're working on at the moment. And in thinking back to that original question, I just want to offer some reflections that have come out of us thinking here in Lancaster about how we upscale urban agriculture in a way that does address food insecurity and the climate emergency. And a key role that we feel it plays is essentially being a tool for bringing food growing back into where people live. And in doing that, people experience the seasons and wider ecological cycles, as well as seeing how food can and could be grown. And in doing this, we feel that there are some pathways that we want to design into how our city approaches this. So we feel that urban agriculture has a role to support in moving consumers, like quite passive buyers of food, into active food citizens, and we feel that urban agriculture has a role to play in that. And it also, through bringing together the allotments, community gardens, and then commercial gardens, and then the rural farms, we feel there's a pathway there for bringing people along from that allotment grower to a slightly larger scale grower to a commercial grower, and then potentially into it facilitates people moving to our rural hinterlands to set up food growing businesses. And I'm going to stop there so that we have more time to hear from you.
Putting these things together remotely and with people you've worked with or met once or twice is really quite, a challenge, but it's really inspiring as well to have people from all over the country who are talking from the same hymn sheet without actually having read the hymn sheet, if you like. It's just this is happening and it's gaining traction. So I think we live in a sort of world where we need to be optimistic and utopian if we can be. So we're going to have a breakout session. Now, I know not everyone's happy with breakout sessions, so if you don't want to take part in the breakout session, feel free not to. And Matt's going to sort that out in a minute. But the question is quite a simple one. What does a model, local, regenerative, urban food growing and well-being model look like? So there's two models there. What does the ideal system look like? And be utopian, think big, think large, be bold. And if you want to stick some stuff in the chat as well, that's great. So Matt, can you sort us out with a breakout room? There we go. So we all know how to do this. You press the join button and see you all in a bit.
for growing our own food over the last year or two. And then, because I've got a greenhouse, I've been generating plants and putting them outside the house for other people to take, which is
Oh, wow.
like a, oh yeah, and I collect my own seeds and use them to germinate the next year's plants.
Brilliant.
Quite an evolving seed bank, I have to say. It's yeah. So it's very interesting. That obviously all organic and all, and we're trying to experiment as much as possible with permaculture practices and seeing how they work and don't work in our context. Yeah.
Self-taught, really.
Brilliant.
Right, don't know what's happening here. Everyone there?
Not everyone yet. We're just closing the breakout rooms as we speak. It should
Okay.
be, they should be closed in about 20 seconds.
Okay. Okay, hi again. As is always the way with these things, we've now got 5 minutes left. With the best plans in the world, you always say, oh, we'll have a bit of a space for feedback and chat, but probably we haven't really got any time for that. If people want to put stuff in the chat, that's great. And I think Matt will be saving that for our use later on. A couple of people have said, can we share some of the information? I think, Anna, can I send you some links that we can send around later?
Yeah.
I'll do that this afternoon if that's okay. So any immediate feedback from anyone, or was it interesting or useful? You can press the reactions button at the bottom right if you like this.
Can I just add to say, the four of us in our group, we were all in a similar position that we don't really know a huge amount about it. We're sort of involved in small groups so we love the idea. It's been brilliant getting all the contacts and sort of making us think more widely about how we might progress a project. And particularly it was useful when Anna mentioned the link with the university, because Essex University's got plant science, human rights and all those kind of things, and I hadn't thought of contacting them, so thank you for that.
Okay, anybody else? Okay.
I feel like, can I raise one that I feel you can't have an urban agriculture session without raising hydroponics and aquaponics as systems and questioning the role of these high-tech solutions in a response to the climate emergency and food insecurity. And I'm interested in people's thoughts that are here around that. Silence.
Okay, well, I'll respond to that. It's quite interesting because there's a lot of high-tech investment going into these systems, which are very, very energy intensive. And with a completely skeptical view, you could say most of the people who are involved in it spend so much money setting up the infrastructure, they go bust because they can't actually produce enough money to cover the cost. From my point of view, and we've started to have this discussion with the Northern Pathfinders places, because growing food at scale in an urban environment will require protected environments, be that polytunnels or anything else. So we're beginning to look at what sort of low-tech polytunnel-based solutions there might be. So that might be double-skin polytunnels with thermal mass included, etc. So we started a dialogue with the Centre for Alternative Technology on that. And it's quite an interesting concept. In fact, I've just put an extra layer of plastic on my polytunnel, but even though I'm in Bristol. So that's the sort of, so we wouldn't rule out the dialogue with tech-based solutions, but I think it's not the focus of our work. I think going back to Elizabeth, we are a soil-based food growing regenerative movement, I think, but we'll see. I think it's 12 o'clock, so I think we better try and wrap up. Elizabeth, any final thoughts if you're there? No?
Yeah, no, I think this has been a really good session, you know, to get people thinking about alternatives. Yeah, really just want to emphasise the importance of soil as being foundation for good nutrition and health outcomes. And I noticed in the chat that somebody made a comment about the link between social prescribing for diabetes. You know, this whole area of using it to try and improve diet-related non-communicable diseases, which is a growing epidemic, you know, not just in the UK but worldwide, is, you know, potentially something to look at more.
Okay, Anna, any comments?
I guess watch this space. The Pathfinder cities are going to be innovating over the next few years, so hopefully we can hear about progress and what's happened and thinking around this in a couple of years' time.
I think with your enthusiasm, Anna, everything's possible, so that's brilliant. Thank you so much, Anna, for your role with the Ethical Consumer Network and for inviting us to this session. It's been really useful, as was the Northern Real Farming Conference, which you also co-hosted so well. And thanks to Mac for sorting us out in the background. I've put my email address in the chat. You can find me on a website, Green Future Associates, as well. And thank you all very much for taking part, and keep smiling.
And as is a tradition in this one, unmute yourself and say goodbye so we actually hear from the people in the room.
Bye.
Thank you. Bye.
Bye.
Thanks very much.
Bye.
Thanks.
Bye.
Bye.
Have a nice lunch.
Thank you.
Yeah.